Turmeric might be the most overhyped spice on the internet. Today, we will cut through the noise, real numbers, real studies, and exactly how to use it for maximum benefit, plus when to avoid it. I'm Dr. T, Food Safety and Public Health. This is a deep dive grounded in peer-reviewed research. We will look at what curcumin, the star compound in turmeric, and actually doses in the body. What outcomes clinical trials have shown, how to combine it with black pepper, and practical ways to use it in the kitchen and as a supplement safely. Turmeric is the spice from Curcuma longa. Curcuminoids are a family of polyphenols in turmeric. Curcumin is the most studied member. Culinary turmeric is 2 to 5% curcuminoids by weight, often about 3%. The turmeric powder contains roughly 60 to 150 milligram curcuminoids. The key problem is the curcumin is poorly water soluble and undergoes rapid first-pass metabolism. So little reaches the bloodstream unless formulated or combined properly. Let's talk about how it works, the mechanism. It works as anti-inflammatory. Curcumin can dial down inflammatory signaling, especially NF-κ, leading to lower expression of COX-2 and LOX and the pro-inflammatory cytokines. It directly scavenges reactive oxygen species and regulates the body's own defenses via increasing enzymes like HO1, SOD, catalase, and glutathione synthesis. And it also can affect the metabolic effects, small but meaningful effects on lipid, like TG and low-density lipoprotein and glycemic markers in some trials, likely via reduced inflammation and improved insulin signaling. It also affects the gut and bile flow. It may influence the microbiome and support bile secretion, which is one reason to take it with fat for better absorption. Let's talk now about how actually benefits. First of all, let's talk about knee osteoarthritis. Multiple randomized trials and meta-analysis show modest pain reduction and improved function versus placebo, with fewer GI side effects than non-steroidal anti-inflammatory drugs in head-to-head comparison. What it means that if you have mild to moderate knee osteoarthritis and can't tolerate non-steroidal anti-inflammatory drugs, a standardized curcumin extract may be worth discussing with your doctor. Now, we're gonna talk about the metabolic health. In people with metabolic syndrome or fatty liver, curcumin has shown improvements in ALT and AST, small reduction in triglycerides and low-density lipoprotein, and sometimes better insulin sensitivity, most consistently when higher bioavailability forms are used for 8 to 12 weeks. Now, we're going to talk about the general inflammation and soreness. Active people sometimes report less DOMS, post-exercise soreness. Effects are variable and depends on doses and forms.